welcome to the channel. Let me stop, I'm not British. Hey guys, welcome to the channel. My name is Clauton Kum. I'm 27 years old. I was born in Cameroon. I'm a first generation college graduate as well as an incoming Podiatric Medical Student. I'm so excited you guys are here joining me on this journey. Let's go. It's going to be an amazing one. The purpose of this channel is to bring awareness to the amazing field of podiatric medicine, all through my eyes as I go through the journey. In no way is this a reflection of any of the institutions that will be in this video or in upcoming videos. Alright guys, before I tell you my life story, let's answer the big question: why medicine? So till this day, I remember my first spark and my first ignition for my love for medicine. And it was in my high school anatomy class where we were learning about the human body. And we had to draw this skeletal diagram with a copy that they gave to us. And I was so fascinated by it once it was completed that I just fell in love with the human body, because it's such a multifaceted, complex system that functions somehow smoothly for majority of people, for a lot of us to be able to do what we do. From that moment, I just became super fascinated and in awe of all of that the human body is able to do and in all that science is able to do. In addition, I also grew up really religious, which instilled in me certain traits of compassion and caring for my fellow neighbor. So in combination with this compassionate trait I have, and as well as my fascination for science and medicine, it just really clicked for me eventually that medicine was the route I wanted to go in. I could use my knowledge of conditions that I would learn and combine it with my compassion for wanting to care for others to have a really meaningful career that could impact lives of many people. Alright, so here's the life story. I got out of college and I decided I really wanted to play soccer professionally because it was something I was also really good at. So I went to Sweden and played professionally for a season, and then I came back to the US and ventured into some other soccer opportunities here for a while. And then I sat back and I was analyzing, and I was like, what do I really want to do in life? What impact do I want to leave in the world when I'm no longer here? And I was like, okay, I really want to do something that's meaningful, as well as I really wanted to do something that fits the certain traits and skills that I have. And so, like I said, medicine was always something I knew I also really loved. That's something I was also really good at. I loved learning, I loved science, I loved anatomy, and I also really had that compassion to really want to care for people and see people improve and just make an impact. So, and be among people who are just very knowledgeable in everything they do at the highest caliber of their training. So I then decided to start, working in healthcare to see what niche would fit me best. So I became a PT aide for a year, and I was like, okay, I didn't really like that side of medicine. So I switched over to the allopathic side, and I was a medical assistant for 2 years and at a dermatology clinic. And I really honestly got one of the biggest mentors in my life from this dermatology clinic. His name is Dr. Sammy Kang. And he, to this day, is my biggest push to venture further into becoming a doctor. He's working with him all this while. He saw certain things in me, certain traits in me, and he really encouraged me to go to school, do my post-bac, fix up all of my applications, things that I needed improvement on, and to apply. So I went to do my post-bac. I went to Elms College in Massachusetts, and this institution actually I have such high regard for because I had a wonderful, phenomenal time while I was there. I got all my pre-med courses that I needed to take in about a year and a half. I was a graduate assistant to the Office of Diversity and Inclusion. I was assistant men's soccer coach. I volunteered at a hospital that was close by. I also shadowed many doctors just to help, really get into what I really wanted to do, to focus in and see different sides of medicine. And it was a wonderful experience. I ended up was so honored for all the different things I was able to do in the community while I was there. So like I said, yeah, my postbac was a wonderful experience. I got to meet so many good friends that I have till this very day. We were all in the grind together, studying for the MCAT, taking all our classes that we needed. We grew such a close bond, and I'm so grateful with all the people that I was able to meet there. I was also so grateful for all the experiences and opportunities that the school allowed me to have while I was there. I also became a representative for the school, so it was just an amazing experience. Now on to the big question, why podiatry? So once I completed my postbac and I took the MCAT and I was getting ready to apply to med schools, I had like a gap year where I had to figure out what I wanted to do with it. I knew I wanted to continue doing something in medicine in order to explore different sides of medicine. And surgery was always something that I was really interested in. So I applied to the surgical tech position at a podiatry clinic, and this is actually where I got my first experience with podiatry. So I was a surgical tech, so I would, set up the operating room, assist them in the procedures, and, break it all down and do it again. I also was dual trained, so I could work on the floor, so I could see what they were doing on the floor side, where they were seeing patients in the office side day to day. All right, guys, when I tell you that this experience working as a surgical tech / medical assistant for a podiatry clinic was the biggest influence in my med school application, I'm literally not joking. Working with these podiatrists, some of who are huge mentors to me today, Dr. Yu, Dr. Haleko, Dr. Spangler, Dr. Han, Dr. Trudeau, Dr. Russo, these podiatrists hugely influenced my decision to go into podiatry, to say that this is for me. Seeing them, how they're able to treat patients on the office side as well as in the surgical side, and seeing their complexity of training and their skill set, I was just like, it's a done deal. Working with these providers, I really got to see the different scope of care they were able to provide to patients because of their expert knowledge and training. A lot of them had lifelong patients. A lot of them were able to bring instantaneous relief to patients in the office. And if not, they were able to go into the OR and provide surgical corrections. A lot of them really crafted the niche of the type of patient pool they wanted to see and the type of cases they wanted to see. A lot of them really came in happy, like they were genuinely they enjoyed what they were doing, you could tell. And this really helped me shape my decision to say podiatry is the route I wanted to go. Podiatry! Once I had this experience, I put in my DPM applications, and I was able to get interviews to schools. And as soon as I got my acceptance, I literally was like, okay, I'm not focusing on the MD and DO applications anymore. This is it. I'm going to accept, and I'm going to run with it. And just run with it because I see a future, a bright future for me in this area. Take this second to thank all those who have been crucial to my journey. Thank you to God, of course, number one, for all his direction and guidance. Thank you to my mom. Thank you to my sister, Ashley. Thank you to my girlfriend, Catherine. Thank you to her family, who have been also very supportive. And just thank you to all my aunts, uncles, friends, everyone, and all the mentors. Thank you so much. I'm so grateful for all your love and support and push and motivation. We did it. Let's go. The journey continues. All right, guys, so you just got the story I'm going to be starting school soon, and I'm so excited for you guys to join me along on this journey. Don't forget to like, subscribe, and share. See you on the next one. Clauton out.